We are now on the record. Today is Friday, February 19th, 2021. The time is 2:30 p.m. The videographer is Alex Polai of Moyer Litigation Video, located in Albuquerque, New Mexico. The court reporter is Teresa Dubois of Albuquerque Court Reporting Service. We are here for the deposition of Secretary Tracie C. Collins, MD, in the case of ETP Rio Rancho Park, LLC, et al., versus Michelle Lujan Grisham, et al., filed in the United States District Court for the District of New Mexico. Case number 1:21-CV-00092, JB/KK. This deposition is being held via Zoom video conferencing. Counsel will please state their appearances and stipulate to the witness being sworn in remotely.
Good afternoon. My name is Pat Rogers. I represent the plaintiffs, and I stipulate to the deposition being taken remotely.
Good afternoon. My name is Maria Dudley, and present with me are my colleagues Holly Agajanian and Kyle Duffy. We represent the defendants in this matter, including Secretary Collins. We also stipulate to the witness being sworn in remotely. Thank you.
Court reporter will now please swear in the witness.
Dr. Collins, I need to have you raise your right hand to be sworn in, please. Do you swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
I do.
Thank you.
Madam Secretary, my name is Pat Rogers. I represent the plaintiffs, and I would like to know, would you prefer to be that I refer to you as Madam Secretary or Dr. Collins? What is your preference?
Dr. Collins will suffice. Thank you.
Dr. Collins, have you been deposed previously?
No.
I'm sure your attorneys have met with you and prepared you properly, but let me discuss just a few of the usual rules. If I ask a question that you do not understand, would you ask me to rephrase it?
Yes.
And the answers have to be verbal. And you understand that?
I do.
And if I cut you off and you're not finished, would you make sure to let me know so that you can finish?
Yes.
And at any time, if you need a break, just let us know, including your important matter this afternoon. I'd like to ask about an honor system here. If you would agree that you would not send or receive any texts, emails, or messages from anyone involved in this lawsuit during this deposition. Would you agree to that, Dr. Collins?
Yes.
What did you do to prepare?
So to prepare, I met with the attorneys to discuss the case.
Did you review any documents?
I received an email with documents that I had a chance to skim. I've been going since about 6 this morning. So I did receive documents, but limited time to review.
Do you remember any of the documents that were sent to you?
No, I do not.
Have you had the chance to talk to Dr. Smelzer about his deposition in the DOH administrative proceeding?
No, I have not.
When's the first time that you were informed there was a dispute or an issue with regard to trampoline gyms or trampoline companies?
It was about 3 weeks ago.
And I don't mean to inquire about information you received from any of your attorneys, but who was that conversation with?
That was with Billy Jimenez.
And what did he tell you?
There's a lawsuit.
Did he tell you anything else?
He didn't.
Objection seeks privilege information. Mr. Jimenez is now general counsel for the Department of Health. I'll instruct the witness not to answer.
Other than Mr. Jimenez, did you discuss the issue of trampoline gyms with anyone?
There was one conversation I had with a member of DOH when there were concerns maybe a month ago with trampolines and safety.
And was that DOH employee an attorney?
No.
And who was that?
Jason Cornwell.
And what did Mr. Cornwell tell you?
I'm just pausing to remember. He basically said there were concerns about our orders and their impact on the trampoline businesses.
Do you remember anything else from that conversation?
Unfortunately, I do not.
And who is Dr. Smelzer?
Do you have a first name?
Oh, yes. Chad B. Smelzer. My understanding is that he is Deputy Chief Epidemiologist, Bureau Chief for Infectious Disease Epidemiology Bureau. Does that help you place him?
Yes, that's correct.
Okay. And he testified in the administrative proceeding, and I want to read this to you. I asked him, will you consider putting trampoline companies in the same category as close contact businesses with gyms and a group fitness exercises and so on? Will you do that, sir? And he answered yes. And I said, will you do that quickly? Because every day they're out of business is one day closer to when they will never be able to open the business. And he said yes. To your understanding, no one in state government is considering putting trampoline companies in the same category as close contact businesses. Correct?
Objection. Seeks confidential and privileged information protected by executive privilege. I'm going to instruct the witness not to answer.
Have you had a conversation with anyone outside of the governor's office concerning Dr. Smelzer's commitment to review these situations and promptly address the possibility that trampoline gyms would be classified as close contact businesses?
No, I have not.
And that's not something that you're considering at this point in time, I take it?
Objection. Seeks privileged information protected by executive privilege. I'm sorry, I'll also instruct the witness not to answer.
Okay. Dr. Smelzer testified that the public health orders in New Mexico are the most strict orders in the nation. Do you agree with that?
Objection. Foundation.
You may answer, Doctor.
I don't know that I say that they're the most strict in the nation. I think compared to neighboring states, they are restrictive.
Are you aware of any analysis of the other states' orders that would address this issue as to the most restrictive public health orders in the nation?
No, I'm not.
Dr. Scrace provided an affidavit in one of these cases, and he said he was talking about the novelty of the coronavirus problem, and he said, we are therefore required to use whatever data and experiences in other states and countries that is available to make the best decisions that we can. Does that make sense to you?
It has relevance.
So data and experiences from other states is something that should be considered?
It's something that can be considered.
Should it be considered?
I think it can be considered. I wouldn't use the word should.
Okay. Are you aware that no other state has prohibited trampolining?
Objection. Foundation. answer if you can, Dr. Collins.
I don't know.
Would that matter to your decision as to where it's appropriate to place trampoline gyms in the definitions and the public health orders, that no other state has prohibited trampoline gyms?
Objection form. You can answer if you can, Dr. Collins.
What I'd like to share is that New Mexico is New Mexico. And while there could be Dr. Scrace referencing other states, which likely predates my tenure, we have to think about New Mexico and what are the issues specific to this state as we make decisions about keeping New Mexicans healthy and safe.
And Dr. Collins, the answer to my question, don't you agree that it's appropriate to consider what experts in 49 other states have decided with regard to trampoline gyms?
Objection form. Dr. Collins, when I object, you can go ahead and answer unless I instruct you not to, okay? So please go ahead and answer if you can.
Okay. Could you rephrase the question?
Yes. Don't you think it's important to evaluate and consider the fact that 49 other states and presumably 49 other states with experts, just like New Mexico, have determined that it's not necessary to prohibit trampoline gyms?
You can consider.
Action form. Go ahead, Dr. Collins.
You can consider that information, but you also need to look at national guidance and also the literature.
Okay. What literature suggests to you that trampoline gyms should not be allowed to operate with the same restrictions, for example, gyms?
So when you consider literature, what we have available is regarding the pandemic itself. There's no specific data that I'm aware of about trampolines.
Would you agree that, as far as you know, the risk of a COVID transmission or infection at a trampoline company is certainly no greater than the same risk at a gym?
Objection, foundation, and form.
I would not agree. I would look at the situation of, can you keep a mask on? Can you socially distance? And so those are two of the three best practices we have.
What would lead you to believe that you can't do those at a trampoline gym and you can do them at a gym?
Because in jumping up on a trampoline, it is hard to keep a mask in place. Having students, or excuse me, having children run around, it's hard to maintain the social distancing.
Are you aware of any studies to support those opinions?
I'm aware of the recommendations of social distancing, mask wearing, and hand washing, but not specific to trampoline parks, no publications.
Have you conducted any experiments on masks and jumping?
No, I have not.
I had occasion to listen into at least parts of the Senate Rules Committee hearing this morning. And I want to make sure I heard you on a couple of points. I understood you to say that the public health orders were based in large part on the concern that New Mexico's healthcare facilities could have been overwhelmed. Am I remembering correctly? That was your testimony this morning?
That's correct.
And what was the peak of the beds that were being used to address COVID? What was the peak? 70-something%?
Foundation.
I don't remember the exact peak number.
You remember approximately? Was it over 70% and under 80?
I do not remember approximately.
You don't remember you don't remember any number whatsoever?
I do not.
Today it's considerably less, correct?
Yes.
Do you have a sense of the magnitude, half, quarter, 33%?
Have not done those calculations. I don't have that number.
So if the public health orders were designed to address that potential problem of being overwhelmed, right now, that isn't a significant problem, is it?
Objection form.
Overwhelming the healthcare system is not a problem as of today.
Okay. And just a question, a little bit off track, but it's been on my mind for some time. A lot of times when there are reports about the COVID patients being treated in New Mexico, there's a reference to non-residents being treated here. Are those non-residents people who contracted COVID outside of New Mexico and were transported to New Mexico?
Sorry, I cannot answer that question.
Okay. You understand what I'm asking, though? There's a number out there that someone has, right?
I understand your question. It's just I don't have that data in front of me.
Okay. Or alternatively, is it were they New Mexico residents who contracted COVID outside of New Mexico and were transferred to New Mexico?
I don't have that data in front of me.
Okay, so our state may be providing beds for persons who are not residents and did not contract COVID in New Mexico. Is that correct?
Objection, Foundation.
Without the data in front of me, it would be an assumption that it's correct.
Who would you ask for that data?
I would ask the healthcare systems.
You said this morning, for the mental health of our kids, it is time to work towards opening. But I think your context was talking about schools. Is that right? That when you said for the mental health of our kids, it is time to work towards opening. Were you just referring to schools or opening up, for instance, exercise to kids?
Objection form.
Yes, I was referring to schools.
Do you agree it'd be a good thing to find ways to get kids more exercise during the COVID pandemic?
Objection form.
I agree that it's a good idea to get kids back in school, and to the extent that they can remain outdoors and distance, it's good to get them exercising.
You don't think there's any form of indoor exercise that is good for kids?
Objection form, Foundation.
I do not agree at this time.
Let me make sure I understand you. So you believe it is not safe for kids to exercise indoor with masks and social distancing and so on. Is that correct?
Objection form.
I'm concerned that we don't have an option to offer that as of today. And so that is what I'm concerned about.
So it's your understanding that kids are not exercising indoors at a number of different facilities, ninja gyms, tumbling academies, and so on. You don't understand that that's going on right now?
Objection form, Foundation.
It's not that I don't understand. I'm looking at it from the lens of the public health and what's safe. And the safest exercise would be outdoors with distancing. If they're up to other activities, I'm not commenting on that.
I'm having a little bit of trouble following you. I don't know if you're saying it's a bad idea, but I know it goes on, or if you're saying tumbling and ninja activities and a collection of indoor exercise for kids is prohibited at this time.
Objection form.
Could you rephrase the question?
Yeah, that was a little bit difficult. I'm not sure I understand what you've said. Do you understand that kids are now indoors and exercising? They can play basketball, they can swim, they can go to a ninja park, they can go to tumbling, they can go to gymnastics. Do you understand that, Dr. Collins, under your current public health orders?
I understand that if they can socially distance and wear their mask, that yes, they can engage in those activities.
Okay. And if they socially distance and wear their masks, then the risk has been considered and those activities are allowed, correct?
Correct.
Objection form.
Do you know how you social distance playing basketball?
Perhaps you can tell me.
You can't do it. Do you know how you social distance? You know how that professional soccer team social distances?
I've not actually considered that question. You'll have to either rephrase it or I can't answer it.
Well, you understand that the states provided an exception for the professional soccer team to practice, right?
Correct.
Was that your decision?
Objection. Seeks privileged information protected by executive privilege.
No, I don't think so. It's the question to Dr. Collins is her authority and her decision-making capacity. And if she didn't make the decision, that's fine. But if she did, she's got to state it.
Thank you for clarifying, Mr. Rogers. I'll withdraw the objection for this question.
Can you clarify the date when that decision was made?
Oh, 2 months ago, 2.5 months ago.
So I'm going to have to tell you that predates me if it's 2.5 months ago.
Okay. Who is it, to your knowledge now, that is responsible for these decisions as to who's going to be allowed to conduct their business and who is not? How is that decision made?
Can you provide more clarification or rephrase the question?
Yes. You're familiar with the definitions in your public health orders, right?
Mm-hmm.
Who's responsible for the verbiage in those public health orders?
That is general counsel.
Okay. Are you involved in that at all?
To the extent that I approve it, yes.
Okay.
Yeah.
We'll get back to that. This morning, you indicated that one of the problems in New Mexico is a lack of public funding for public health. Did I get that correct?
Not completely. It's a problem throughout the country.
Okay. Because actually the funding for public health in New Mexico puts New Mexico in the top 10 of the 50 states, right?
Objection foundation.
That's not correct.
Where does New Mexico fall under the guidelines and studies of this factor?
I'd have to look more explicitly at the data, but when I say it's not correct, our funding is not sufficient to sustain our activities.
Okay, so you're not disagreeing with the proposition that we may be in the top 10 of states per capita for funding, for public funding. You're stating that whatever it is, it's not enough?
Correct.
Okay. You stated that we will not redo the matrix. And I think I understood you to mean that the green, yellow, and red scheme was not going to be redone. Is that a correct understanding? Is that what you meant by the matrix?
Objection form.
So as of today, we're not going to redo the matrix, but we could change how we approach things moving forward as we look at what goes on in the state with COVID.
And one of the things that you mentioned was the positivity rate, that would be a significant factor in possible changes. Is that correct?
That could be one of the metrics. That's correct. Could be.
What else?
Metrics.
And I interrupted. I apologize, Doctor. Did you finish?
No, I was clarifying it could be one of the metrics.
What are the other potential factors?
So in addition to positivity, there is also looking at cases per county and the 8 per 100,000 cut points. So there's the percent of positivity of test, and then there are cases per county. And
I'm not quite certain I'm hearing you. Case something per county case?
Cases per county?
Okay. Wouldn't that be subsumed in the positivity calculation for each county?
Positivity is based on cases divided by test.
Okay.
And then when you look at cases by county, that's cases by number of people in a county.
Is there any positivity rate that would allow the state to open up certain or all of the close contact recreational facilities that are now prohibited from opening?
I don't have an absolute number for you today. We will have to evaluate moving forward what trends we see in the cases.
Do you know any other state that does it this way, that provides for openings if a positivity rate is below a certain figure?
I do not know.
One of them would be California. And in California, if the positivity rate goes below 5% in any county, then trampoline gyms, among others, can open. California is considered to be the second most restrictive state with regard to trampolining. Would that be a good figure to shoot for and to allow trampoline gyms or companies to open when the positivity rate in a county went below 5%?
Objection form, Foundation.
You know, we are evaluating data specific to New Mexico, and we need to continue to look at our numbers to decide what makes sense for us.
So do you have any sense of what numbers would make sense for New Mexico in that regard, the positivity rate?
No, not as of today.
You told the Senate committee this morning that it was vital to have businesses at the table. And by that, I understood you to say that it was important that the state hear and understand the concerns and in some instances, the desperation of the people who are out of work and the employers who are in financial straits. Are you aware of any trampoline owners getting a chance to talk to DOH or anyone about the devastation that they're trying to deal with?
Objection form.
No, I'm not aware.
Are you aware that the definitions of close contact business and close contact recreational facilities has changed over time?
No, I'm not aware.
Would that make any difference to your evaluation of whether trampoline gyms belong in the category with gyms and group fitness classes or not?
I would consider that it might influence, yes, how I'm thinking.
What else might influence how you're thinking with regard to whether trampoline gyms have been properly placed in a category?
No additional thoughts at this time.
Okay. I'd like to ask about the current public health order. It's Exhibit 1. Mr. Artuso?
I'm working on it, Pat. For some reason it pulled up. Oh, I see. There it is.
Okay. Dr. Collins, this is the current public health order, January 29th, 2021. And I'd like to refer you to page 13, paragraph 6. And I think you were asked a question somewhat referencing this morning. And this is your order, correct?
Correct.
And you reviewed it before you signed it, right?
Correct.
And it indicates that any and all state officials authorized by the Department of Health may enforce this order. What's the process? Well, what's the process for authorizing any and all state officials to enforce this order?
In my short tenure here, I've not actually seen the paperwork that spells out the process.
Do you know who it is at the Department of Health that authorizes any and all state officials to enforce the order?
I seek the input of General Counsel for guidance.
Okay. This would require some sort of authority for someone else to issue and authorize the enforcement of this order. If you're not doing it, someone else must have been authorized to do so at the Department of Health.
Objection form.
It has to be authorized by the Department of Health. And so I would want to defer to the paperwork to understand the process that we have in place.
Okay. It's government, so there's going to be some sort of paper trail here and assignment of authority, correct?
Correct.
Okay. You were asked this morning as to why each and every citation that the Department of Health proposes a $5,000 fine. And I think you indicated that that was just not something in your knowledge at this time, right?
Objection form.
What I indicated was the up to 5,000 was the range.
Right. Didn't you tell the committee that you thought it appropriate for discretion to be exercised and perhaps citations less than $5,000 might be appropriate?
Objection form.
Yes.
And what would be the criteria to decide whether a $5,000 maximum proposed fine is appropriate or something less?
I do not have criteria in front of me. It would be something I would consider, and I'd want to speak with counsel about the range.
Okay. Under these circumstances, these are businesses which the state has shut down and has threatened with a $5,000 violation for each day that they're open, correct?
Up to 5,000, correct.
Yeah. So under the circumstances where a business is shut down, has no income, got to shed employees, they still have all sorts of obligations, rent, loan, insurance, and so on. How is any fine appropriate if they have no money coming in and they're closed?
Objection form. Foundation.
Public health orders during this pandemic are to keep New Mexicans safe.
And do you have some thoughts as to how it makes sense to propose a $5,000 fine against small businesses or individuals who are now out of business and have no source of income to take care of their family or their employees?
Lack of enforcement of the public health order will put people at risk.
Is there anything that you can add to your answer?
No.
What's the process for sending out a notice of contemplated action by the department?
Again, in my short tenure here, I need to revisit with general counsel to understand what that process is.
And so during your tenure, the notices that have been sent out, you haven't been asked to approve, nor are you informed about the notices. Is that correct?
Objection. Foundation.
Can you rephrase the question?
Yes. During the time in which you have been acting secretary, you haven't been asked to approve any notice of contemplated action by the department. Is that correct?
That's correct.
Do you know who it is that decides to send out these notices?
That comes from General Counsel.
Is that Mr. Jimenez?
He's one of them, yes.
The administrative process to challenge these citations starts with the hiring of a hearing officer who is hired and appointed by the Department of Health. The regulations provide that the hearing officer must hold the hearing within 60 days of the notice. The hearing officer has 30 days after the hearing to submit his report recommendations to you for a final decision. And your final decision is due 45 calendar days later, and the decision must be mailed within 15 days, certified mailed after that. So the regulations provide for 150 days plus however long it takes to get the US mail. Let me first start with this. Have you signed off on any recommended decisions?
Since my start date of December 14th, I don't recall signing off on any.
Is someone else doing that task, signing off the decisions that are assigned to the secretary?
Objection, Foundation.
What I can say is that I've signed public health orders that I remember signing.
And so, the best of your memory, you've never had to review recommended decisions and make the final decision on behalf of the Department of Health concerning one of these COVID violations?
I have deferred to General Counsel.
Have you been consulted at all during your time as acting secretary concerning those decisions?
I do not recall.
You're aware the state of New Mexico has taken a legal position that no damages will be paid to any business for any shutdown under these public health orders. You're aware of that, right?
Counsel, I think you should wrap up this line of questioning. We've given you some latitude, but if you're going to relitigate your administrative law case here, that's not appropriate.
Okay, thank you. Can you answer, Dr. Collins?
I cannot.
Okay. The department has not adopted a rule that would allow people and businesses to challenge the public health orders. Has the department?
Objection, Foundation form.
I'm not aware.
Okay. What do you know about the impartial hearing officers hired by the Department of Health to review the Department of Health's decisions?
Can you rephrase the question?
Yes. There are, by regulation, impartial hearing officers are hired by Department of Health to review the Department of Health's decisions. And do you have any knowledge about those procedures?
No, I do not.
Do you have any knowledge about the hiring of impartial hearing officers?
No, I do not.
Are you aware of any DOH hearing officer ever finding against the department in any COVID-related citation to fine or shut down a business?
Mr. Rogers, if you're going to continue to relitigate your administrative law hearing or law case, I'm going to have to direct the witness not to answer at this point.
I think you're misunderstanding. We're not at that point in the administrative law case. I'm asking about procedures, and I'm asking about the state's system and process for addressing concerns and the devastation that is being inflicted upon small businesses. So I'm going to ask Dr. Collins to answer that question. Or let me see if we can speed this up. You don't have any knowledge about what hearing officers do with regard to citations, right?
Not as of today. That's correct.
And so you wouldn't know if any hearing officer ever hired by the Department of Health has ever reduced a fine proposed by the Department of Health, right? You wouldn't know.
Objection form.
I don't know. Correct.
And you wouldn't know if a hearing officer hired by the Department of Health ever found against the department in any administrative hearing related to COVID or any public health order, would you?
Objection form.
You know, 2 months on the job and the word ever seem a bit contradictory. No, I do not.
Okay. Exhibit 2, please. Executive Order 2020-04 is the governor's sort of foundational or original, one of the early executive orders, and it's still in effect. I'd like you to turn to page 2, paragraph 1. The governor is directing all branches of state government to minimize physical and economic harm. Has the Department of Health done anything to minimize physical and economic harm?
Objection form.
Can you rephrase the question?
Yes, and why don't you take just a minute to read the paragraph, because I skipped from the beginning where it reads, all branches of state government shall cooperate with federal authorities, other states, and private agencies to provide resources and service necessary to minimize physical and economic harm. I'm going to ask you to tell me what the Department of Health has done to address the economic harm of the shutdown orders that have been, the public health orders that have been promulgated.
Objection form.
We have worked to keep New Mexicans safe and to reduce morbidity and mortality. By keeping people alive, we've allowed for them to still have an opportunity in the future to reopen their businesses.
And so that would be the extent of the assistance to minimize economic harm that you're aware of?
Objection form.
There's probably more, but as of today, that's what my response is.
In the current public health order, the most recent figures indicate 176,211 positive COVID-19 cases and 3,355 related deaths in New Mexico. Does that sound about right?
Sounds pretty close, yes.
New Mexico does not use the antigen testing, uses PCR testing, right?
Objection form.
You'll need to clarify where the PCR testing is done.
In New Mexico, you referred to it this morning, testing for COVID-19 is via the PCR testing, right?
In the community, that's correct.
Okay. You're drawing a distinction, and I'm not sure what you mean in the community. What do you mean?
Right. So largely when someone goes to one of our sites for testing, it's PCR testing. When we have testing in shelters, it's antigen testing.
Okay. On the antigen testing of the 176,211 positive COVID cases, how many may be false positive tests?
Objection, form foundation.
I don't have that number.
There is a number though, right? I mean, that's in the scientific literature, and false positive tests are just a function of where we are today in the application of the science.
Objection, form foundation.
False positives vary by the test, and they are a part of that, but it's not a number that we readily have available. It's not factored into sensitivity.
Why isn't it factored into sensitivity?
Because sensitivity is true positives or true positives plus false negatives.
How can you have a true positive if you don't know how many false positive tests you have?
We don't have that data readily available. Okay. That's my lab.
Okay. So if I understand, there is a number, there's scientific analysis of the percentage of false positive tests for antigen testing. It's just something that you don't have at this point in time.
Correct.
So under the PPV, the positive predictive value, a test with a 98% specificity would have a positive predictive value of just over 80% in a population with 10% prevalence, right? And that would mean 20.
Oh, I'm sorry. Go ahead.
That would mean 20 out of 100 positive tests would be false positives.
Objection, foundation, form.
Can I direct your attention to Exhibit 2A, the Fda letter?
Sure.
This is from the FDA, and are you familiar with this analysis and this work by the FDA concerning false positives and antigens?
I have not read this report.
Okay. Is there a reason that the state has not attempted to address the false positive tests with antigens?
Objection, foundation, form.
With broad use, except in shelters, of PCR testing, we've not looked at this data in antigen testing.
Okay. The total New Mexico population is approximately 2 million. Is that about right? And given the 176,211 reported positive tests as of February 4th, that would be about 8.8% of the population.
Objection, form.
If you have a calculator, that sounds correct. It's about 2.1 million for the population, and yes.
Right. And do you have a sense, or better yet, an actual number or percentage of how much of the testing is antigen and how much is PCR?
I do not have a number.
Is the antigen just used in those communal settings that you discussed, jails, shelters and so on?
Actually, it's also used in long-term care facilities, but it's combined with PCR testing.
Okay. Can I have an exhibit 3, please? This is the report on the PCR testing for COVID-19. And as of February 4th, page 2, it indicates that 2,386,859 PCR tests had been conducted in New Mexico. And so we now have tested more than the total population of the state, right?
Objection form.
Tested more. Can you rephrase the question?
Yeah, we now have more tests than we have people, right?
Objection form.
The number of tests based on this one number you're showing me is greater than the number of people in the state of New Mexico.
Okay. And I did use a calculator. If you take the positives and divide by the tests, I get about 7.4% of the tests were positive. Does that sound approximately correct?
If you're very
Objection
good
foundation form. You can go ahead, Dr. Collins.
okay, if you're good with a calculator and I can trust you, sounds correct.
Okay. PCR tests also have a false positive rate, right?
Objection foundation form.
Any test has both a false negative and a false positive rate. That's correct.
Do you know what the false positive rate is for the PCR test administered in New Mexico?
No, I do not.
And that's something that the state could determine, right?
I have to think about that question. Again, it depends on the lab and what test they're using.
Other states and other countries calculate the false positive rate for PCR tests, right?
Objection form foundation.
I don't know what other states are doing.
Do you know that there's scientific literature about this issue, the false positive rate of PCR tests?
Yes, I do.
And have you studied that?
Not recently. It's been a fire hydrant since I started.
Can I have exhibit 4, please? Can I, page 3, please? This is the conclusion here. With a 1% infection rate in the test population, a false positive rate of only 0.5% leads to nearly 40% of the positive test results being wrong. Is that consistent with what you know about the literature and false positive rates?
Objection form.
I would have to review this, what you're showing me in depth, to give you an honest answer that I would feel good about.
Okay. Has the department been doing anything to control for false positive tests in the PCR testing?
Controlling for false positives is at the level of the actual lab with the type of test they use. It's not at the level of the Department of Health.
The Department of Health could address the tests in each facility and determine false positive rates depending on how the facility administers the test, right?
Objection foundation form.
We can certainly look at the data and decide if we think that it's a good approach, yes.
And the conclusion of this article here is that it says here, in fact, just the opposite is true. Negative results are reliable and positive results are not when the infection rate is low here. Well, let's back up. Let's start. Let's start here. Notice that this doesn't align with most health authorities have been telling us, which is that we can trust a positive PCR result as proof we are definitely infected, but that we can't rely on a negative result as proof we're not infected. And the conclusion is, in fact, just the opposite is true. Negative results are reliable and positive results are not when the infection rate is low. Do you have any reason to disagree with that, Dr. Collins?
Objection form.
I would want to see this entire article and not just take snapshots to give you an answer.
Okay. I've sent the article to your council, and I hope that they send that to you as well as some other material that I'm hoping that you look at carefully. Is the New Mexico, and I want to use words that you're comfortable with. I read to you Dr. Smelzer's conclusion that New Mexico was the most aggressive with regard to restrictions on businesses and activities. And I believe that your response was, well, maybe not the most, but certainly New Mexico is aggressive with regard to the public health orders, right?
Objection form.
Correct.
So, given that New Mexico is either the most restrictive with regard to businesses and activities, or one of the most, how is it clear that the lockdowns have worked?
So what we can see from the start of our first case in March of 2020 until now, we actually did quite well until around October when we started seeing a surge in cases. So our practices of distancing, hand washing, and wearing masks were in effect containing the virus and the spread and helping to reduce hospitalizations until we began to relax in October.
What study do you have that suggests that the New Mexicans relaxed in October and that is the cause for the increased incident of COVID-19 positive results?
There is no study.
Didn't the entire nation undergo the exact same thing, a significant increase in reported positive tests in October?
Objection form.
I'd have to go back and look at the data.
Isn't the entire nation right now also benefiting from the significant reduction in COVID-19 positive test results?
Objection form. I would not say use the word significant reduction, but there is a downward trend, yes.
Well, why isn't it significant? Just looking at the New Mexico numbers, those are certainly significant reduction from October, aren't they?
How are you defining significant?
However you usually use the word.
I usually use the word significance when there's a p-value of less than 0.05, and in the absence of a study, I don't have that p-value.
Okay. All right. Do you know what the actual, do you have a sense of what the actual reduction is from October until now?
I do not.
Okay. In the report, the February 4th, 2021 report of 176,211 cases and 3,355 COVID-related deaths, if you do those numbers, I get a fatality rate of 1.9%. I'd like to compare that to a state that did not lock down. Exhibit 5, please, Florida. And actually before this, Dr. Collins. Since the state's restrictions upon close contact recreational facilities has not changed since June, it would not be correct to suggest that the state's prohibition of close contact recreational facilities such as trampoline gyms is responsible for the increase in October, right?
Objection form.
I can't answer that question.
Well, let me see if I can help you. There could be no possible conclusion, no possible science that would support the proposition that the increase in October is due to close contact recreational facilities, since the state has had them shut down since June, right?
Objection form, foundation.
Can you rephrase the question?
Yes. I'm on the verge of talking about some cause and effect and correlation and causation and regression analysis, but I wanted to ask just a simpler question. The cases that increased in October, it cannot possibly be blamed on close contact recreational facilities because those have been closed since June, correct?
I cannot make that assumption, but it would be hard to believe that if they've actually been closed, that they've contributed. So that's my response.
Are you aware of any report of the transmission of COVID-19 in a trampoline gym or park or business ever?
Sir, you have to keep in mind there's asymptomatic and symptomatic. I'm not aware. It doesn't mean it doesn't exist.
Okay. And recently there were 21 million reported COVID positive tests in America?
I have not looked at the Johns Hopkins website in a few weeks, so I don't know.
Okay. Can you help me with the math? I want you to assume that, that there are 2 possible reported transmissions in the world, and there are 100 million reported cases. Can you help me with the math? What would that look like as a percentage? How many zeros before the 2? 2 out of 100 million.
Sir, I'm going to defer to you to use your calculator.
Well, that ain't going to work. I'm a lawyer. I could not figure this out if it was 7 zeros or 9. And so I guess we'll have to leave that one open. It's a minuscule number, right? 2 out of 100 million?
It's a small
Objection foundation.
It is a small proportion.
And if there are no reported transmissions in America, in the 49 other states that allow trampolining gyms to be open, would that suggest to you that certainly be evidence that the risk of allowing trampoline gyms to operate is pretty small, negligible perhaps?
Objection form, foundation.
For every case, you have several people who've actually been exposed and are carriers. I cannot make that leap that you're asking me to make and conclude with you that what you're saying is correct.
So as a matter of science, the fact that there is no reported case of transmission of COVID in a trampoline gym in America is not significant to a decision as to whether the risk is also minuscule, the risk of opening that trampoline gym.
Objection form, foundation.
Is that correct?
the lack of a reported case is not sufficient to say that there is no case. It's just not reported or minimally reported. So there's a reporting issue there.
What's the reporting issue?
Yes or no that you're reporting where the case came from and you're reporting it accurately.
The 21, do you have reason to believe that there is transmission of COVID in trampoline gyms in America, although there are no reports to that effect?
Objection form.
Community spread is a real issue. And when you have a large amount of cases in a given county, the spread can occur in multiple places. And the idea is to keep places that could increase that risk closed.
Council, if I may, we've been going over an hour. Is now a good stopping point to take a quick break?
It looks like he might have gotten disconnected.
Oh.
Maybe, I'll take us off the record until, oh, is he back? There we go.
1,000 apologies, Dr. Collins. It's large fingers and small buttons. I apologize, Doctor.
Council, I just asked if we could take a 5-minute break. Is now a good time?
Absolutely.
Thank you. I appreciate it.
Dr. Collins. Yep.
You're now off the record. The time is 3:37.